But like,
so we have,
I said the amendment adds every member of the. I did say that too. And then, the Chair Barnes reiterating, like, who has a question on this bill that was voted in?
so we're gonna start in 1 second. We're waiting for some members. Thank you so much. You can keep talking. How are you? Nice to see you. All right, here they come. Yes. All right, we can get started. Oh, we are live. Okay.
Yes.
So good afternoon. Welcome to voting list number 17. This is Thursday, April 4th. It is 2:31 in the afternoon. This is the Health and Government Operations Committee. My name is Jocelyn Pena-Melnick, the chair of the committee, and to my left is the vice chair of the committee, Delegate Bonnie Collison. So we're going to start with, I want to thank the members for coming on time and for all the hard work you have done. I mean, I'm really proud of our work and staff. Thank you so much. We're going to start with, and welcome to staffer from the wonderful Appropriations Committee. Michelle, how are you? Good, nice to have you. So we have Senate Bill 482, Governor's Office Engaging Neighborhoods, Organizations, Unions, Governments, and Household, is known as the Enough Act of 2024. It was voted out of appropriations favorable with amendment. And we have the analyst in appropriation, Michelle, and the analyst in HGO, Lindsay. It is the cross-file of House Bill 694, which we will do after this one. We are secondary, appropriations is primary. Michelle.
Thank you, Madam Chair.
You're welcome.
So the committee made a number of changes to the program. First, the committee added eligibility provisions for neighborhoods in the program so that eligible neighborhoods need to be within 30% poverty census blocks and serve a community school with a certain percentage of poverty. The amendments create certain requirements for the program, add requirements for meetings of the Children's Cabinet, including an annual report, repeals a requirement for MSDE to complete the Neighborhood of Indicators Poverty Report and instead requires the office to complete this report, requires the office's 3-year plan to be submitted to the General Assembly, and requires the office to develop a centralized database on all programs available for children, youth, and families in the state.
Thank you, Michelle, for explaining it. Any questions for the committee? Delegate Hill.
Thank you, Michelle.
You're welcome.
I'm curious about these new restrictions on which communities qualify. In particular, I know that community schools are a great bonus, but I was under the impression that we have a number of communities that could benefit from a community school and qualify, but we haven't been able to establish. So am I wrong about that? And because if I'm right about that, that means that there may be communities that are very much in need, and because they haven't come off the list of having a community school yet, they're going to be doubly penalized because they don't have a community school and they can't qualify for this.
I think that was a policy question that the committee really went back and forth on. The Appropriations Committee really felt strongly that the state made a choice and with a poverty program through the Concentration of Poverty Grant Program, which gives money to schools with certain percentage of students in poverty. The committee felt like establishing a different standard for poverty could conflict those two things. So really felt like this program needed to be in tandem with that. But in acknowledging that some communities, we ran the numbers on 90% and 80% of how many schools that would be. It's like 70 schools and then like 190 schools. So in acknowledging that kind of how the neighborhood is also different than the school, the students in the school, we added the 30% census block poverty metric, and some provisions that give the department flexibility in providing the neighborhoods for eligibility. So
qualifying neighborhoods have to already have community schools? Or do they have to be able to qualify community schools under the other definitions, even if they don't actually have one?
The neighborhoods chosen have to have students that are served in a community school. So yes, in a sense.
Delegate Johnson, followed by Taveras.
Thank you, Madam Chair. And is this a standard definition for poverty anywhere else?
The concentration of poverty program is unique to Maryland, so this would be a unique definition of poverty. We are asking the office to study in this further report how other states do determine poverty in their states to figure out if there is a more uniform standard.
My pleasure. Delegate Taveras.
Hi, Michelle. Nice to meet you. Hold on, I want to hear you. Okay, so
We haven't heard that one in a while.
I need to.
You still hear
The
a lot,
classic statement is I need to hear you better. So let me put on my glasses.
Okay,
So,
sorry, I couldn't resist.
how about Michelle? So, so the question I have is that, in looking at the poverty, tracks, really they overlap almost, if not 99% with J40 designation for disadvantaged communities. And I know that we heard the J40 bill over in appropriations, and I changed it to, there's been some amendments and we changed it to a dashboard that required a report to come out of the Office of Children. And I just thought that it would be advantageous to not just analyze from a perspective of money, but also environmental impacts in these same neighborhoods, in these same tracks. And it would be really good if we could, I mean, I know that y'all want to pass this bill, and get it out, but I mean, it would be really good to see if we could overlap some of that information.
Madam Chair, I would say, and Miles is here from the governor's office in the audience. They have an annual report that they have to do on this program anyway, and the office has latitude to have more discretion to add more information. So I think that might be more appropriate, an offline conversation with the department to do that.
And I'm fine with that.
Yeah.
I just want to make sure that it is something that we can still continue to have that conversation, because I know that they like the idea, and maybe in the scope of what we're doing may not be legislatively, doesn't need to have, maybe there doesn't need to be a legislation for something that we could actually have a conversation about and still get to do under what's being done here.
Yeah,
Thank
nothing
you.
in the language restricts that, so.
Thank you. Delegate Chisholm,
Thank you, Madam Chair.
you're welcome.
So if I'm reading this right in fiscal note right, the $15 million, the governor could spend that on this any year that he wanted to. This is just simply mandating that he does it.
Yeah, the governor always has discretion to put as much money in the budget over the mandate. So this bill says at least 15 million in FY26. It does not have a mandate in the out years, and that would be up to the governor's discretion. As well as throughout the bill, we made clear that these provisions are subject to the availability of funds.
Okay, thank you.
Thank you. Delegate Hill, coming back again?
Yeah, coming back again, it's sort of the same point. Do you have any numbers, or maybe Miles has numbers, if that 30% of children living in poverty and is served by a community school were changed to an or? How many communities would that add in or leave out? What is the difference between the and the or?
I don't have the difference in the and the or. We do have a map of what communities would fall in based on these definitions. And we have a map of where all the community schools are under the first eligibility provision with an overlap of the census data. So we have that, and we can share that with everyone in the committee so you can check that. But because there are so many community schools, I think that's what the committee appropriations struggled with, is that there's so many community schools, there had to be some sort of limiting factor. And so, yeah, yeah.
About we have community schools, so how do we limit neighborhoods with community schools to make sure that that we're getting the most needy ones. I'm going the other way. I'm talking about communities with 30% or more poverty that just don't happen to have a community school. So I'm
Most-
going in the reverse direction, unless you're telling me that we have so many community schools that every community with 30% or more poverty has one.
I wouldn't say every community, but most of them had a solid overlap. There were interesting counties that they had more community schools than 30% poverty, and that's probably because students go all over the county to go to school in that county. But most of the blocks for the census blocks were close to or had a community school in it, but we can send you the map for you to confirm that.
It's okay. These are good questions. Any other questions? Okay. All right. Excuse me? Can you send them up? Thank you. All right. May I have a motion on the amendment, please? They've been moved in second. Any further discussions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition to the amendments? Seeing none, on the bill as amended. The bill has been moved in second. Any questions or concerns about the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? Shalega, Chisholm, Morgan, Riley, and Kipke. All right, and thank you very much. Let's do House Bill, the same one, House Bill 694. It is favorable. Michelle, thank you so much. We're gonna do the next one, the same bill. It's the same one. So House Bill 694, who's gonna present it?
We actually didn't do the House
Oh.
bill,
Okay,
so
okay. Okay, all right, no problem.
okay.
So we're going to hold 694, okay? Thank you very much. Okay. So let's go to House Bill 614. Michelle, thank you for being with us. 614 Maryland Medical Assistance Program, Health Insurance Coverage for Prosthesis so Everybody Can Move Act. It was voted favorable out of subcommittee. It is Lisa and Collison. Lisa.
This bill expands the current mandated benefit for coverage of prosthetic devices to be coverage for prosthesis and replacement for prosthesis. Beginning January 1st, 2025, Medicaid must provide coverage for prosthesis as specified under the bill. Each carrier and Medicaid MCO must submit a specified compliance report by June 30th, 2030. And the Maryland Healthcare Commission and the Maryland Department of Health must review utilization of specified codes, evaluate the cost impact of requiring coverage for orthosis, and report to committees of the General Assembly by December 1st, 2024. There are no amendments on the Senate bill.
Okay, Delegate Collison. Is that Collison?
Yes, yes. So this is a bill, the way this bill has come over to us, I think, Lisa, it does have they did remove the orthosis from the Senate bill, right? Yeah, okay, so that's right. That's why we're favorable on this one. This bill is going to help a lot of people, and I appreciate the efforts of the sponsor to work, the House sponsor and the Senate sponsor, to get this to a place where we could fiscally manage it and then study what the fiscal impact would be if we were to expand it in the future. So with that, I move the bill.
Second.
Any questions on the bill? All right, may I have a motion? This will be moved in second. All those in favor say aye.
Aye.
Any opposition on this bill? Seeing none, the bill passes. House Bill 865.
There are amendments on page 13 of your packet that conform House
Move
Bill
the amendment.
865.
The amendments have been moved in second. It's the same bill that we just voted on. Any questions or concerns? Seeing none?
To remove the orthoses, what the word from the title?
They are, they do it.
Perfect.
Okay, so may I have a motion again, please? Is it moved in second? Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Let's move on. Co-sponsor, who does not want to be on the bill? Okay, everyone wants to be on it. All right, let's do Senate Bill 952, assisted living programs, assisted living referrals, requirements and prohibition. It was voted favorable with amendment from the subcommittee. It is Lisa and Rosenberg. Lisa.
So who is not here as far as sponsors? Is it just Woods and Kaiser? What? Okay. So just don't have Woods. Are we on Senate Bill 952? This bill establishes additional requirements for an assisted living refer. An assisted living refer must maintain general liability insurance and require employees to obtain a criminal history records check. An assisted living refer may not request payment of a referral fee from an assisted living program more than 2 years after making the referral. The Office of Healthcare Quality must maintain a user-friendly database of licensed assisted living programs. There are amendments on page 16 in your packet. The first amendment number 1 is technical. Amendment 2 strikes references to HIPAA and requires the assisted living referrer to provide the client or client's representative with a description of the services the referrer will provide any financial agreements to a client or client's representative in writing or electronically, and comply with specified data privacy provisions on certain dates.
Rosenberg.
Madam Chair, this bill as amended is supported by both the advocates who brought the bill to us as well as the providers. The final issue was privacy protections, and we voted on second reader today on a major comprehensive privacy bill coming out of Economic Matters. That bill would address the privacy issue here, but not until that bill's effective date, which is October 1 of next year, so that the final sticking point, which we have resolved, is language that provides for comparable privacy protection for the first year of the effectiveness of this bill. Same privacy protection as will be taking place, will be the law of the state with the enactment of the other bill that we heard today. So move favorable.
You're moving the amendments? The amendments have been moved and seconded. Is there any discussion, questions? See.
Kudos
Oh.
before the motion. If I may, kudos, thank you here for the expertise.
Thank you, Delegate. Delegate
Sorry,
Olson.
thank you.
Thank you. Good morning, afternoon. Where it's talking about if the referrer has a financial agreement with the client or the client's representative, is that for like the place for mom type companies? Okay.
So the difference is, if I may, Mr. Chair, for a place like, for an entity like a place for mom, that business does not charge the client. They charge the assisted living program after the person that they've referred moves in and lives there for 30 days. So that's how they get reimbursed. But there are other organizations, other assisted living referrals that have a direct relationship with the client themselves or the client's representative, and they get paid by them and not the facility. So that's why you have that second line.
So what does this mean for those other places? Are they able to collect their fees or not able to collect their fees? And did we address if it's multiple places, how that works?
It depends on the contract that they have with the client. If they have a contract that says that they will provide the service for a fee from the client, then they can share the information, but they have informed consent of the client.
So it's only directed to the client, not to the assisted living facilities.
In those contracts, but not for a place for mom or caring.com. Those big national organizations have a different funding model. Yes.
Okay, that's what I really need to know.
Everyone is.
All right, thank you.
Oh my gosh, everyone is on board with this, Delegate. Any other questions or comments? Delegate Johnson?
Thank you, Madam Chair. Is the language in the other bill, is there any conflict or is it the same?
The privacy bill.
Correct.
No, it may not be identical, it's not identical language because we had to conform it to this specific bill,
Okay.
but it's the same principle.
So when that bill kicks in, will it take precedence or will this? Okay.
There's uncodified language that states that that's what will happen.
Okay, thank you.
In
Thank you,
this
Madam
bill.
Chair.
The data privacy bill is 40 pages long. And if we were going to incorporate it, it's in there, I guarantee. So as the subcommittee chair said, the principle and concept is fully covered under the amended version of the bill that you have in front of you. Okay? All right. The amendments have been moved. What? We haven't voted on the amendments yet. The
Okay,
chair's gonna do it.
so the amendments were moved in second. All right, so all those in favor, any questions or concerns? All those in favor of the amendment say aye.
Aye.
Any opposition? See none on the bill as amended. All right, so it's been moved in second. Any questions or concerns? See none, all those in favor say aye.
Aye.
Any opposition? See none, it passes. Okay, did we do both bills?
No.
So 1263 is the same bill that we just voted on, favorable with amendment, Lisa. So the amendments that we just voted on are the same, have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended. The bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, who does not want to be on the bill as a co-sponsor? All right, everyone wants to be on it. Let's move on to Senate Bill 991, Behavioral Health Language Assistance Services Pilot Program. It was actually moved favorable with amendment out of the Public Health Subcommittee. It is Aaron and Bagnell. Aaron.
The bill establishes the Language Assistance Services Pilot Program to provide meaningful access to behavioral health care to children with limited English proficiency and establish a competitive grant process for local behavioral health authorities to provide reimbursement to behavioral health providers for language assistance services. There's an amendment on page 18 of your packet that was adopted in the Public Health and Minority Health Disparities Subcommittee. And this strikes the requirement that MDH adopt regulations to implement the program by a certain date.
Delegate Bagnell.
Thank you, Madam Chair. By striking that requirement, it gave the department flexibility. They thought they could actually implement it more expeditiously. It passed not unanimously, but bipartisan, and I would move the amendments.
So the amendments have been moved in second. Thank you, Delegate Bagnell. Any questions or concerns on the amendments? Seeing none of those in favor, say aye.
Aye.
Any opposition on the bill as amended? The bill has been moved in second. Any questions or concerns on the bill as amended? Seeing none of those in favor, say aye.
Aye.
Any opposition to the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley. Thank you. Thank you very much. And the last bill that we have before concurrences is Senate Bill 1099, Emergency Services, Automated External Defibrillator Naloxone, Co-location Initiative Requirements for Public Buildings. This is favorable with amendment. Aaron.
This bill expands the purpose of the Public Access Automated External Defibrillator Program to include an initiative to co-locate up to 2 doses of naloxone with each automated external defibrillator placed in a public building. The Emergency Medical Services Board must develop and implement the initiative in collaboration with MDH and adopt regulations jointly with MDH. Then the initiative will be funded with funds from the Opioid Restitution Fund. The bill was not in subcommittee, but there is a reprint of the bill in your packet beginning on page 19. There are 2 amendments that have been proposed by Chairman Payne-Melnick in the bill. If you look at handwritten page 36, in lines 21 through 24, this goes to how the initiative will be funded and provides that it will be funded using funds from the Opioid Restitution Fund that are appropriated through the state budget. There's also an amendment on handwritten page 37 of your packet after line 8. And this deals with the regulations that will be adopted by the EMS board and MDH. and provides that initial prioritization of the public buildings eligible to receive funds with, they will adopt regulations that establish the initial prioritization of the public buildings that are eligible to receive funds. And then also there will be a goal of co-location of naloxone with each automatic external defibrillator located in a public building by October 1st, 2027.
Okay. Are there any questions or concerns regarding these amendments? Delegate Johnson?
Thank you, Madam Chair. I just wondered if we looked at, I mean, it specifies naloxone, but do we look at any equivalent that is cheaper?
So according to the department, naloxone is cheaper. It's the generic. It's the one that they know the cost that they're used to. And we can always come back in the future to deal with it. My pleasure. Delegate Hill.
Question, we can always come back, and I think to Delegate Johnson's point, I think I brought it up in the subcommittee too, is we could also, the alternative would be to say, or a similar drug as the department deems appropriate, right? We could just, so we don't have to keep coming back, similar anti-opioid medication as the department deems appropriate.
I'll have Aaron address your point.
Yeah.
I did talk to Marie right before this because I went back to the bill hearing and saw your questions. They would like to keep naloxone. That is, and it is in the bill that's the drug currently with FDA approval for community use, and that's spelled out in the bill as well. So they want that language.
Yes, Delegate Alston.
Thank you. I was just wondering about the public building portion. Does it include schools and the
Yes.
grocery stores? It does.
It includes not grocery store, schools,
Okay.
right?
Yeah, Delegate Austin, the definition is on handwritten 36, lines 1 through 8. That provides your definition of public building.
Thank you for the question. Any other questions or concerns regarding it? Okay, so may I have a motion on the amendments?
Move the amendments.
They've been moved in second. Any questions or concerns? Seeing none, all those in favor of the amendment say aye. Any opposition? Seeing none on the bill as amended. The bill has been moved in second. Any questions or concerns on the bill? Seeing none, all those in favor say aye. Any opposition? None. Too bad we can't get on it. It's a Senate bill. It wasn't crossed. It's a good bill. Okay, so we have concurrences. This was the last bill that we had. But today, we now have concurrences. Who would like to get started first? Erin, and then Lisa, and then Lindsay.
House Bill 51 is the Maryland Pediatric Cancer Fund and Commission. The amendments conform the bill to Senate Bill 13, which you just passed, same amendments.
All right, move to concur. Wonderful. The next one.
House Bill 1171, which is the non-prescription drugs and devices provision by registered nurses and sale of contraception through automatic devices. Again, this makes the same amendment that HGO made to Senate Bill 944, which exempts the prohibition on the person offering for selling or offering for sale a natural membrane condom by means of a vending machine from the existing criminal and civil penalties for violations of Title 21, Subtitle 2 of the Health General article.
All right, we're concurring. All right, next.
House Bill 1143, this is the Maryland Emergency Department Wait Time Reduction Commission. The Senate amendments require the Secretary of Health and the HSCRC to co-chair the commission. And there's other just technical amendments that were made.
All right, any questions, concerns? Is there a motion to concur? All right, great, let's go.
House Bill 1230, that is the Tianeptine Consumer Protection Act. The Senate amendment would make the bill an emergency measure.
Wonderful.
Okay, last one. House Bill 328, hospitals financial assistance policies revisions. The Senate amendments, as it passed the House, it provided that a hospital could not consider household monetary assets in determining eligibility for free and reduced care under the hospital's financial assistance policy. The Senate amendments changed that to provide that a hospital may consider only household monetary assets in excess of $100,000 when determining eligibility for free and reduced care under the hospital's financial assistance policy if retirement assets that the IRS has granted preferential tax treatment as a retirement account, including deferred compensation plans qualified under the IRS code or non-qualified deferred compensation plans, are excluded.
Okay, Delegate Collison.
Delegate Kipke made a point that we all had to think about around folks who have a considerable amount of cash assets. The Senate took that seriously. I think it adds the appropriate considerations around what the source of incomes are. So I would move to concur.
All right. Any questions or concerns? All right, we will move to concur. Lisa.
So this is a concurrence for House Bill 68, continuing care retirement communities, transparency grievances, and unit reoccupancy. The Senate amendment clarifies that the governing body will determine whether a matter is confidential in its sole but reasonable discretion.
Okay. Delegate Collison, is that Collison or? Well, go ahead. Rosenberg's, okay. Any questions or concerns on this one? All right, seeing none, we move to concur. All right, Lindsay.
We have House Bill 152. This is Department of the Environment Study on Death Care and Funeral Practices. The amendments require MDE in consultation with MDH to contract with an academic institution or research consultant to conduct the death care study, and then expands the requirements of the study.
Okay.
You're gonna not concur.
So for this one, we're not going to concur, and we're going to assign the following committee members, which will be the chair of the conference committee, Delegate Collison, White Holland, and Delegate Hutchinson. Okay, so if the Senate chooses to have a conference committee, they'll make their appointments as well. I'm sorry, their assignments. And then you guys can get together and work it out, okay? They will be Collison, chair of the conference committee, White Holland, and Hutchinson. And it is House Bill 152, Department of the Environment Study on Death Care and Funeral Practices. Yes.
So just to expand on that, we did ask MDE for their feedback on that change. The bill, as it was passed by the House unanimously, I believe, had a $100,000 fiscal note. The sponsor had worked with MDE prior to, introducing the bill on that. And MDE noted that they can't get exact estimates from potential, contractors, because that would preclude them from participating in an RFP, but they estimated that this would add about $50,000 to the fiscal note.
Okay. All right. And the sponsor is here, and she has confirmed that. All right. So we move to assign a conference committee. All right. Everyone's in agreement? All right, let's move on.
House Bill 581, this is state government permits, licenses, and certificates processing, the Transparent Government Act of 2024. The amendments from the Senate require the catalog from the units to include the current information technology system used for license processing and any remaining associated tasks still performed manually with the system. These conform it to the Senate bill, which has already passed the House unanimously.
Okay, so to conform it to the Senate, to
their Senate bill.
Their Senate bill. Okay, we move to concur. All right, wonderful. Next.
House Bill 850 is state procurement, small business preference procurement. The amendments from the Senate strike language specifying the manner in which a unit may achieve targets for procurement awards to small businesses. This was addressed in another bill that has already passed both chambers. It passed the House unanimously. It was House Bill 962 from Delegate Phillips. The two bills had the same goal, but the wording was slightly different. So rather than conform it, they just struck it from this bill since it's already in the other bill.
All right, any questions, concerns? Move to concur? All right.
And the last one I have is House Bill 1486. This is Economic Development Cyber Maryland Fund and Program Alterations. The amendments from the Senate required the governor to include a $250,000 appropriation in the annual budget. bill to be used for talent pipeline management. HGO put this appropriation in Senate Bill 816, the cross file, at $99,000. That passed second reading this morning in the session that you had this morning. Sorry. So
Okay,
you're gonna not concur and appoint a conference committee.
okay. So for that conference committee, I would like the chair to be Delegate Kurd, the members Hill and Kipke. Okay. And that's it. We're done with the concurrences for today, and we're finished voting those 5 bills for today. There shouldn't be much left truly on our agenda at all. So hopefully we have one more bill to vote? Okay. Okay. And is that it? Yeah, who knows what comes, but we don't have a lot. But you know what? It's a great feeling because you have all worked so hard, right? And we got, if you notice, a lot of our stuff early out, right? Where we don't have to worry about being stuck right across the street in rules or anything like that. And my hope for you and for myself and for our wonderful team here is that on Saturday you can be relaxed. On Monday, you can be relaxed as well, right? And not have much to worry about. And it paid, we did this last year. And we did it last year, we did it again, and it works well, okay? So I want to thank all of you for being part of this team and for working so hard. And Michelle and Andrea, again, thank you so much for all your hard work. You know, they do all the you know, getting it to the State House and all the paperwork. So thank you so much. I hope you get to relax just a little bit before we go. What we're supposed to go, what, at 4:30? 4:30 to the floor, okay? Thank you so much. Oh, wait.